Good morning. We are the Group 3, Set A. The members are the following. Carl Levert Nobles Choca, that's me. Ms. Lyra Kate Alfonso, Ms. Benina Castillo, Ms. Maria Sofia Nicole De Lawis, and Ms. Jella May Beso. And our topic is blood incompatibilities. What is blood incompatibility? Every person's blood has certain characteristics. If a baby's and mother's blood are incompatible, it can lead to fetal anemia, immune hydrops, or erythroblastosis fetalis, and other complications. This can also happen to blood transfusion when the recipient blood is not compatible to the donor's blood. In order to easily understand this topic, let me first discuss to you the different blood types, the components of blood and their compatibility. The precise amount of blood in a person's body will depend on their size. In addition, the blood's composition varies between individuals. This difference in structure is what makes a person's blood type. An individual's blood type depends on which genes they inherited from their parents. So, what are the components of blood? All blood contains the basic components. First, the plasma, that is the liquid part of the blood. Second, the red blood cells that delivers oxygen. Next is the platelets that helps in blood clot. And lastly is the white blood cells that fights infection. So let us now proceed to the blood types. What are the blood types? Categorizing blood according to types help prevents reaction when someone gets a blood transfusion. Red blood cells have markers on their surface that characterize the cell type. These markers, also called as antigens, are proteins and sugars that our body used to identify the blood cells as belonging in us. The antibodies are the proteins found in the plasma, as I have shown you earlier. So we have two main blood groups. The two main blood groups are ABO and RH. So first, let us start with ABO blood group. So we have type A, type B, type AB, and type O. So as you can see in the picture, type A has A antigen with B antibody. Type B has B antigen attached to its red blood cells with A antibody. Type AB has both A and B antigen attached to its red blood cells with no plasma antibodies. And type O has no antigen attached to its RBC with both A and B antibody. So now let us proceed to the RH factor. Blood is further classified as being either Rh positive and Rh negative. So what do you mean by Rh negative and Rh positive? Rh positive meaning it has Rh factor and Rh negative without Rh factor. So basically, there are 8 possible blood types. So we have A plus, B plus, AB plus, and O plus. So those are the Rh positive. We also have A negative, B negative, AB negative, and O negative. So those are the Rh negative. Having any of these markers or none of them doesn't make a person's blood type any healthier or stronger. It is just a genetic difference, like having our green eyes instead of blue or having a straight hair instead of curly. So now let us proceed to blood compatibility. All RBCs have antigens except the ORBCs. These proteins that can elicit a contact response when they come into contact with its corresponding antibody. So in short, they stimulate the antibodies in the plasma to defend the body. Therefore, if you get the same RBC and antibody together, this will cause an immune response called agglutination. So here's a picture of the agglutination. So basically, it is when the RBC will glue together and the donor's red blood cells will lysis. This is also known as hemolytic transfusion reaction. Therefore, you have to know what antibodies are present in a patient's blood compared to the type of antigen present on the surface of the RBC from the donor. So now let's dissect each group and see who can donate and receive from whom. So first, it is important to note that the recipient plasma antibody must be opposite of what type of antigen is found of the donor's red blood cells. So A can donate to A and AB and can be recipient of O and A. B can donate to B and AB and can be recipient of O and B. AB can donate to AB and can be recipient of all because AB is universal recipient, and O can donate to all and because it is a universal donor and can be recipient of O. So it's also important to note that Rh positive can either receive Rh positive or Rh negative. However, Rh negative can only receive Rh negative. So since I have already discussed the blood types, blood compatibility, and blood components, let us now proceed to the main topic, which is the blood incompatibility. Next slide will be presented or discussed by Lyra Kate.
Thank you, Carl. Now, let's move on to blood incompatibilities in pregnancy. First, ABO incompatibility. ABO incompatibility happens when a mother's blood type is O and her baby's blood type is A or B. The mother's immune system may react and make antibodies against her baby's red blood cell. Here's a picture of ABO incompatibility. As you can see, the mother has type O and the baby has type A. ABO incompatibility causes. Blood type is based on genes from each parent. So if one parent is type O and one is type A, the baby will likely be type A. The reason the baby wouldn't have type O blood is because the genes of O is recessive, meaning it's only expressed if the baby gets it from both parents. ABO incompatibility in newborns usually happens in a gestational parent, which is the mother. With type O blood has a baby whose blood is type A, type B or type AB. Type O blood has anti-A and anti-B antibodies which cause the incompatibility. The next slide will be discussed by Benina.
Thanks, Lyra. Let's move on to symptoms of ABO incompatibility. There are two main signs that a newborn has an ABO incompatibility. First is the jaundice. What is jaundice? Jaundice is the most common problem caused by ABO incompatibility. Jaundice occurs when an orange-red substance called bilirubin builds up in the blood. If more red blood cells are broken down at once than is normal, the bilirubin that result will deposit fatty tissue under the skin, causing it to take on a yellowish hue. And this is the picture of a baby with a jaundice. Next is anemia. What is anemia? Anemia may not always occur with ABO incompatibility, and it is usually mild. Sometimes it has no symptoms, or a newborn may have such as low energy, difficult feeding, pale skin, and a fast heart rate and rapid breathing while resting. The anemia is caused by the faster than usual breakdown of the baby's red blood cells caused by the mother's antibodies. These antibodies can linger in the baby's circulation for weeks after birth. Because of this, some babies will need to have blood tests to check the level of anemia. And this is the example of anemia. As you can see, the normal blood has many red blood cells and the anemic blood has the fewer red blood cells. Now let's move on to treatments or intervention. Not every baby with ABO incompatibility will require treatment. Often, anemia resolves on its own without treatment or with changes in diet. and not all babies develop jaundice, or they have jaundice that is mild and doesn't require extensive treatment. It will depend on how much bilirubin collects in the baby's blood. First treatment is extra feedings. Some infants with mild jaundice will get better on their own simply by feeding more often. A temporary increase in feedings will lead to an increase in bowel movements, which is how excess bilirubin exits the body. Parents who breastfeed may need to supplement their baby's diet with a formula for a few days if nursing alone doesn't do the trick. Next treatment is phototherapy. For infants whose jaundice is more severe, phototherapy or light therapy is effective. The baby's skin is exposed to light waves that transform the bilirubin into substance that can pass through the baby's system. The baby rests under special lights wearing just a diaper and soft eye patches. Instead of or in addition to phototherapy, a baby with jaundice may be treated with a bili blanket, which uses fiber optics to break down bilirubin. Next is blood transfusion. In rare cases, a baby with an HDN or hemolytic disease of the newborn will need to be treated with a type of blood transfusion called an unexchanged transfusion. This is when a portion of a baby's blood is replaced with type O blood. A child who becomes severely anemic as a result of an HDN or hemolytic disease of the newborn may need a more traditional blood transfusion, in which they receive extra blood to replace blood that's lost. Next slide will be presented by Carl.
Thank you, Ben. Now let's move on to the prevention of ABO incompatibility. Routine blood screening tests in pregnancy doesn't screen for ABO incompatibility. Furthermore, testing in pregnancy does not improve outcomes for the baby. Unfortunately, there are no preventative measures for ABO incompatibility. Next is for the diagnosis. First, have the cord blood of all babies whose mothers have an O blood group and the father either type A or B blood tested. The theory behind this approach is that if the baby is either type A or B and they test positive for direct antiglobulin test or DAT, the baby can then be followed closely for jaundice. Second or last is the alternate approach is to screen any baby who becomes significantly jaundiced, particularly within 24 hours. The next slide will be presented by Jella.
Thank you, Carl. The second blood incompatibility in pregnancy is Rh incompatibility. Rh incompatibility occurs when a woman who is Rh negative becomes pregnant with a baby with Rh positive blood. With Rh incompatibility, the woman's immune system reacts and creates Rh antibodies. These antibodies help drive an immune system attack against the baby, which the mother's body views as a foreign object. Here's a picture of Rh incompatibility. As you can see, the mother has Rh negative blood cell while the baby has Rh positive blood cell. Next is the cause of Rh incompatibility. During pregnancy, red blood cells from the unborn baby can cross into the mother's blood through the placenta. If the mother is Rh negative, her immune system treats Rh positive fetal cells as if they were a foreign substance. The mother's body makes antibodies against the fetal blood cells. These antibodies may cross back through the placenta into the developing baby. They destroy the baby's circulating red blood cells. Next is the symptoms of Rh incompatibility. Rh incompatibility can cause symptoms ranging from very mild to deadly. In its mildest form, Rh incompatibility causes the destruction of red blood cells. There are no other effects. After birth, the infant may have, first is the yellowing of the skin and whites of the eyes, which is jaundice, or low muscle tone, hypotonia, and lethargy. The next slide will be discussed by Lyra.
Thanks, Jala. Now, let's proceed to complications of RH incompatibilities. It is associated with the development of maternal RH sensitization and hemolytic disease of the neonate or HDN. Rhesus disease is a condition where antibodies in pregnant woman's blood destroy her baby's blood cells. It is also known as hemolytic disease of the fetus and newborn or HDFN. This happens because of the process called sensitization in which mother's body will try to fight them off by producing antibodies against them. Other complications include brain damage due to high levels of bilirubin or carnecterose, fluid buildup and swelling in the baby, or hydrops fetalis, and lastly, problems with mental functions, movement, hearing, speech, and seizures. Here's a few pictures. The next slide will be discussed by Nicole.
Thank you, Lyra. RH incompatibility can be prevented with the use of Rogrum. Rogrum is a sterilized solution made from human blood that contains a very small amount of RH-positive proteins. These proteins keep your immune system from making the permanent antibodies to RH-positive blood. Rogrum is given as an injection. Therefore, prevention remains the best treatment. Treatment of an infant who is already affected depends on severity of the condition. Infants with mild RH incompatibility may be treated with phototherapy using bilirubin lights. For immune globulin may also be used. For infants severely affected, an exchange transfusion of blood may be needed. This has decreased the levels of bilirubin in the blood. Prevention, special immune globulins called Rogrum, are now used to prevent RH incompatibility in mothers who are RH negative. This injection prevents the development of antibodies against RH positive blood. However, women with RH negative blood type must get injection during pregnancy, after a miscarriage or abortion, after a prenatal test, after injury to the abdomen during pregnancy. Next slide will be presented by Benino.
Thanks, Nicole. Next is blood incompatibility in blood transfusion. Blood incompatibility in blood transfusion can occur if you receive the wrong type of blood during a blood transfusion. It's a rare but serious and potentially fatal response to incompatible blood by your immune system. These reactions are extremely rare because doctors are aware of the danger of using the wrong blood during a transfusion. Next is the cause of blood incompatibility of blood transfusion. Human error is the most likely cause of an incompatibility reaction. If your transfusion uses the wrong blood type, it could be the result of mislabeled blood, incorrectly completed forms, or a failure to check donated blood before the transfusion. Next slide will be discussed by Carl.
Thank you, Ms. Castillo. And for the symptoms of blood incompatibility in blood transfusion, when you are getting a transfusion of any kind, it is very important that you let your nurse know right away if you notice any changes in how you feel, such as itching, shivering, headache, chest or back pain, throat tightness, nausea, dizziness, trouble breathing, or other problems. For the intervention, you may need to enter the intensive care unit. After stopping your blood transfusion, the medical staff will attach a saline drip to the line to keep it open. The goal of treatment is to prevent you from having kidney failure, intensive blood clotting, and blood pressure that's abnormally low. You may receive oxygen and intravenous fluids. You may also receive a drug to increase your urine output. If you're at risk of having widespread clotting, you may receive a transfusion of plasma or platelets. And for the prevention, most hospitals and blood banks have systems in place to reduce the chance such as a reaction will occur. These include, first, checking the identities of donors to ensure that their details match the information on their blood samples. Second, correctly labeling stored samples. And last, the double checking the blood type of both patients and blood packs before each transfusion. So that would be all. Thank you for listening.